Hello viewers, let's start with our first session, breastfeeding, safeguarding maternal and child health. Breastfeeding is just not a feeding method. It's a fundamental component of maternal and child health. Research consistently shows that breastfeeding has a profound impact on both maternal as well as child health outcomes. Therefore, understanding the significance of breastfeeding is crucial for ensuring optimal health outcomes of both mothers and children. World Health Organization provides clear guidelines for optimal infant and young child feeding practices, which are essential for ensuring the health and well-being of infants and young children. These recommendations include early initiation of breastfeeding within 1 hour of birth, exclusive breastfeeding for the first 6 months of life, and introduction of nutritionally adequate and safe complementary foods at 6 months. So at around 6 months of age, infants should begin receiving complementary foods in addition to breast milk to meet their increasing nutritional demands. However, breastfeeding should continue alongside complementary feeding for up to 2 years of age or beyond, thereby providing additional health benefits and nutritional support to the baby. Now, videos on complementary feeding are not a part of the present channel. However, they will be uploaded separately after we finish off these sessions. Before we proceed further, let me first define what is meant by exclusive breastfeeding, as we will be frequently using this word. It is a term used to describe a feeding practice where the infant receives only breast milk and no other liquids or solids. This means that water, formula, juice, or any other food or drink is not given to the infant. The exceptions to this rule are oral rehydration solutions or drops, syrups of vitamins, minerals, or medicines as prescribed by a healthcare professional. Continuing with the optimal breastfeeding impact on child health outcomes, let's see the concerning trend in malnutrition, particularly its prevalence among infants. Malnutrition is noted to strike predominantly during infancy, beginning as early as 3 to 4 months after birth. This aligns with the critical period of rapid growth and development in infants, where proper nutrition is of paramount importance for healthy growth. A gradual increase in the prevalence of malnutrition is also seen over the first years of life. At 0 to 6 months, it affects approximately 11 to 12% of infants, which is a significant proportion. However, the situation worsens rapidly with malnutrition rates reaching 37% by the time infant reach 12 months of age. This suggests a concerning escalation in the number of infants not receiving adequate nutrition during this crucial period of development. The peak of malnutrition occurs around 23 months, suggesting that a substantial number of children are entering their toddler years already affected by malnutrition, which can have long-lasting consequences on their health and development. In 2022, global estimates indicate significant challenges in child nutrition. Approximately 149 million children under the age of 5 were classified as stunted, meaning they were too short for their age. Stunting is often indicative of chronic malnutrition and can have a long-term implications for physical and cognitive development. Around 45 million children under 5 were classified as wasted, meaning they were too thin for their height. Wasting is typically a result of acute malnutrition and is associated with increased mortality rates among young children. Another concern was the prevalence of overweight or obese children, which affected approximately 37 million individuals. This indicates a growing issue of overnutrition in some regions, which can lead to various health problems, including cardiovascular disease and diabetes. These statistics underscore the complex and multifaceted nature of the global nutrition challenge, which with significant numbers of children suffering from both undernutrition and overnutrition related issues. Now, the term U5 stands for under 5, referring to the children under the age of 5. The Lancet study reported that there were a total of 16 lakhs or 1.6 million child deaths during the first year of life. The study further detailed that during the next 4 years of life from age 1 to age 5, an additional 8 lakhs of children died. The study highlights the significant burden of child mortality, particularly during the first year of life, but also underscored the ongoing risk of death during the subsequent early childhood years. In 2018, the total number of child deaths under the age of 5 were reported to be 4 million. This represents a tragic loss of young lives and indicates the significant challenges faced in reducing child mortality rates globally. Among these 4 million children died deaths, a staggering 75% occurred within the first year of life. This statistics underscores the vulnerability of infants during their early months, where they are at the highest risk of mortality due to various factors, including malnutrition. Let's see how breastfeeding affects cognitive ability. During the first few years of life, here each column represents 1 year up to 5 years of age, the human brain undergoes an astonishing period of growth and development. One of the most remarkable aspects of this development is the formation of neural connections. The rate at which these connections are formed is truly staggering. Research suggests that during the early years of life, more than 1 million neural connections are established every second. This rapid pace of neural development is unparalleled in any other stage of life. The brain begins to develop shortly after conception and undergoes rapid growth and differentiation throughout fetal development. By the time the baby is born, many of the basic structures of the brain are already in place. Neurogenesis, the process of forming new neurons, is particularly active during the prenatal period. This underscores the importance of maternal health and prenatal care in ensuring optimal brain development for the growing fetus. After birth, the pace of brain development accelerates even further during the first 2 years of life. Between the ages of 0 to 3, you can see approximately 80% of the brain structure is formed, and by the age of 5, about 90% of the brain structures has already been established. Numerous studies have been done to associate breastfeeding with IQ. The above studies shows also aim to determine if prolonged and exclusive breastfeeding positively impacts children's cognitive abilities at the age of 6.5 years. The intervention based on the baby-friendly hospital initiative significantly increased exclusive breastfeeding rates at 3 months and sustained these rates up to 12 months. At age 6.5 years, children in the experimental group showed higher scores of cognitive tests, including verbal IQ, which was more than 7.5, performance IQ, which was more than 2.9, and full scale IQ, which was about more than 5.9. Additionally, teachers rated their academic performance in reading and writing higher. These findings from the largest randomized trial in human lactation strongly suggest that prolonged and exclusive breastfeeding positively influences children's cognitive development. Continuing further, you can have a look at the neonatal mortality. The risk of neonatal mortality increases significantly with delays in the initiation of breastfeeding. It's noted that late initiation of breastfeeding, defined as after the first hour of birth, is particularly concerning. Such delayed initiation is associated with a six-fold increase in the risk of neonatal death after 3 days of life. This statistic underscores the critical role of breastfeeding in protecting newborns against life-threatening conditions during the early days of life. The study indicates that comprehensive strategies are required to prioritize education, support, and infrastructure to enable mothers to initiate breastfeeding effectively, regardless of their circumstances or location. This can be done by ensuring access to skilled healthcare providers, implementing breastfeeding friendly policies in healthcare facilities, and providing lactation support. You can see the potential impact of early breastfeeding initiation on reducing neonatal mortality. You have also seen in the earlier slide. It suggests that if all infants were breastfed from day one after birth, approximately 16% of neonatal deaths could be prevented. Further, if breastfeeding was initiated within first hour after birth, which we want, the potential reduction in neonatal deaths could be even greater, with an estimate 22% of deaths being avoidable. This is a study from Lancet which suggests that about two-thirds of under 5 child deaths could be prevented by interventions that are available today and are feasible in low-income countries at high levels of population coverage. For each of these countries, death from specific cause were first calculated. If present, coverage levels were increased to universal coverage. Universal coverage is defined as 99% of all interventions except exclusive breastfeeding among children under 6 months of age. For exclusive breastfeeding, the target was set at 90%. The graphical presentation shows under 5 deaths that could be prevented in the 42 countries worldwide in the year 2000 through achievement of universal coverage with individual interventions. It's important to highlight that breastfeeding stands out as the most impactful intervention in reducing under 5 child mortality, surpassing all other interventions by more than double in effectiveness. Let's have a look at the protection provided by breast milk. Research shows that the level of protection provided by breast milk is maximum in the neonatal period, and it steadily declines with age during infancy from 5.8 for infants less than 2 months of age to 1.4 for 9 to 11-month olds. This graphical presentation of the study provides a clear overview of the declining trend in breast milk protection during infancy and emphasizes the importance of breastfeeding during the early stages of life for optimal infant health and immunity. Now, comparative analysis of breast milk protection against infant mortality due to diarrhea and respiratory infections specifically shows that in the first 6 months of life, protection against diarrhea is substantially greater, that is 6.1, than against the deaths due to acute respiratory infections, that is 2.4. However, interestingly, for infants aged 6 to 11 months, almost similar levels of protection were observed against diarrhea and deaths due to acute respiratory infections, that is 1.9 and 2.5 respectively. This suggests a convergence in the protection effect of breast milk against these two causes of mortality during this age range. When considering deaths occurring during the second year of life, the pooled odd ratios from the 5 studies range between 1.6 and 2.1. This indicates that a moderate level of protection provided by the breast milk against mortality in the second year, though significantly lower compared to the first year. Let's see what we know more about health benefits of breastfeeding. Studies have compared children who were breastfed for longer durations, up to 12 months, with those breastfed for shorter periods. It has been found that children exposed to more extended periods of breastfeeding had a reduced risk of developing dental caries when compared to those breastfed for shorter durations. Another systematic review and meta-analysis investigated the relationship between breastfeeding and acute otitis media, commonly known as ear infection, in children. It was found that breastfeeding offers protection against AOM in children up to 2 years of age. This protection was observed to be greater for exclusive breastfeeding and longer duration of breastfeeding. Specifically, exclusive breastfeeding during the first 6 months was associated with a significant reduction in the likelihood of ever having acute otitis media in the first 2 years of life. The reduction in risk was approximately 43%. Now let's have a look at the long-term impact on child health. In a systematic review and meta-analysis, it was found that breastfeeding decreases the risk of type 2 diabetes and reduces the odds of overweight or obesity by 13%. In another systematic review and meta-analysis, relationship between breastfeeding and childhood allergic diseases was investigated. The findings suggest that breastfeeding may offer protection against asthma, particularly in children aged 5 to 18 years. Additionally, there is a weaker evidence indicating a protective effect for eczema in children aged less than equal to 2 years and allergic rhinitis in children aged less than equal to 5 years. Interestingly, the protective effect against asthma and eczema appears to be more pronounced in low-income countries. Let's see how breastfeeding is beneficial for maternal health. This study analyzed data from about 10,000 women with ovarian cancer and about 11,000 controls to investigate the association between breastfeeding and ovarian cancer risk. Key findings included breastfeeding was associated with a 24% lower risk of invasive ovarian cancer. Regardless of parity, ever breastfeeding was linked to a reduced risk of all invasive ovarian cancers, particularly high-grade serous and endometrioid cancers. The duration of breastfeeding also influenced risk reduction. A single breastfeeding episode of 1 to 3 months was associated with an 18% lower risk, while breastfeeding for 12 or more months was associated with a 34% lower risk. The study also concluded that breastfeeding is significantly associated with a decreased risk of ovarian cancer overall, particularly for the high-grade serous subtype, which is the most lethal form of ovarian cancer. These findings suggest that breastfeeding could serve as a modifiable factor to lower ovarian cancer risk independently of pregnancy alone. Besides ovarian cancer, breastfeeding also protects lactating mothers against breast cancer. Breastfeeding is associated with a 4.3% decrease in the risk of breast cancer for every 12 months of breastfeeding. This reduction in risk is in addition to the 7% decrease observed for each childbirth. The cumulative effect, as you can see, of breastfeeding and childbirth results in a significant decrease in the overall risk of developing breast cancer. Breastfeeding has also been shown to primarily reduce the risk of triple negative breast cancer, which is particularly aggressive and challenging to treat, by 20%. Additionally, Additionally, breastfeeding has been found to reduce the risk of breast cancer in carriers of breast cancer gene 1 mutations by 22 to 50%. These mutations are genetic mutations associated with an increased risk of breast and ovarian cancer. In 2013, a comprehensive review of 32 studies have provided a compelling evidence regarding the association between breastfeeding and breast cancer risk reduction. The review found that among Paris women, those who have given birth, they are called Paris women, the risk of developing breast cancer was 14% lower among those who had ever breastfed compared to those who had never breastfed. The protective effect of breastfeeding was found to be even more significant for women who breastfed for a longer duration, specifically women who breastfed for a cumulative period of 12 months or longer. experienced a 28% lower risk of breast cancer compared to those who had never breastfed. Now, these findings emphasize the importance of breastfeeding promotion and support as a key strategy for breast cancer prevention. Continuing with the reduced risk of breast cancer in breastfeeding mothers, Victoria and colleagues conducted a study to estimate the global impact of breastfeeding rates on breast cancer mortality. They found that the existing global breastfeeding rates already prevent approximately 20,000 annual deaths from breast cancer. The study also identified an opportunity for additional preventable deaths by increasing breastfeeding duration. In high-income countries such as the US, increasing breastfeeding duration to 12 months per child could prevent an additional 20,000 deaths from breast cancer annually. Similarly, if you talk about low and middle income countries, extending breastfeeding duration to 2 years per child could also prevent a significant number of deaths from breast cancer. As we conclude our first video on breastfeeding, safeguarding maternal and child health, we have explored the profound influence breastfeeding has on maternal and child health as well as child survival. In our next session, we will delve deeper and explore the unique benefits and essential nutrients present in breast milk that contribute to the overall well-being and development of infants. Join us as we uncover the remarkable advantages and nutritional components of breastfeeding, further emphasizing its importance for the optimal growth and health of babies. Furthermore, we are committed to addressing various issues faced by lactating mothers in subsequent sessions, whether it's concerning breastfeeding techniques, managing lactation challenges, or navigating the journey of motherhood. We will provide insights and support to empower lactating mothers. We also invite you to share your thoughts, questions on any topic you would like us to cover in future sessions. Please feel free to reach out to us via email at rajinder_gulati@hotmail.com given in the slide. Your feedback and input are invaluable to us as we strive to create informative and helpful content. Last but not the least, I thank you for joining and looking forward to continuing this journey together. Have a wonderful time.